So China is the world's biggest manufacturer of medical equipment. And this is perhaps most visible if we indeed look at face masks. So according to statistics from the International Trade Database of the United Nations, China accounted for 44% of the world's exports of face masks. And the next largest exporters, which are the United States and Germany, only accounted for 7% and 6%. But it's not just face masks. So China also produces huge quantities of other medical products, such as disinfectants, safety goggles, and so on, but also more sophisticated products, such as ventilators. And this, of course, is not to say that necessarily the entire production process takes place in China, nor does it say that China is the only country producing these medical equipment. But it does say that if the production process in China is interrupted, or if export controls in China are being put in place, then the world supply of these medical equipment will be reduced dramatically. On the other hand, we can sort of even be grateful for the fact that the production of medical equipment is concentrated so much in China, because by the time the coronavirus had reached other countries in the world, the Chinese economy had recovered to the point where it could aid these countries and alleviate some of the stress that was caused by a reduction in their supply. So looking at commercial exports of medical equipment from China first, we see that almost for all of these products that became critical during the coronavirus pandemic, the United States is the single biggest importer, and it is typically followed by countries like Germany or Japan. And this is not very surprising, because even the most simple economic models of international trade would suggest that the bigger two economies are, the bigger the trade flow between them will be. Much more interesting, on the other hand, is if we look at donations of medical equipment from China, because economically they may be less important. They only comprise roughly 1% of total trade, but they're much more politicized, and this is what makes them so interesting. And if we look at the map, basically, where donations of medical equipment from China went during the coronavirus pandemic, we see that those countries that were most severely affected by the coronavirus very early on, countries like Italy or Luxembourg, are also among the biggest beneficiaries of donations of medical equipment from China. So this is a good thing. But we also find countries such as Ethiopia or Hungary among those biggest beneficiaries of Chinese donations of medical equipment. And this is something that made us curious. So we investigated whether or not there are further economic and political factors associated with these donations that go beyond purely humanitarian need. So before I start discussing economic and political factors, I would like to emphasize the point that humanitarian need, as proxied for by the COVID-19 infection rates in a given country, is positively associated with the number or the quantity of medical equipment that a country is able to attract from China. So this is a good thing. Humanitarian need seems to be one of the determinants of the exports of medical equipment. Then moving on to economic factors, we see that past trade ties with China play a positive role. So if your country has traded a lot with China before, then this means that it's also easier for your country during the pandemic to attract these very specific medical goods from China. Another economic factor that seems to play a role is FDI, so foreign direct investment into China. So if your country has invested in China, that seems to make it easier for your country to attract medical equipment from China in return. These are the economic factors that we have observed so far. Then politically, we see that, first and foremost, those countries that recognize the government in Taiwan are completely excluded from donations from China. We're not the first ones to observe this, so this seems to be generally true for Chinese aid in general. Another political factor that we have seen is that China seems to have reciprocated the donations it got during its own coronavirus outbreak in January and February in the months of March and April. Then moving on to a more fine-grained analysis, we're now not looking at China as a single unit or a single entity, but rather we're looking at individual Chinese province we find a very sizable effect for whether or not your country has some sort of sister relationship with the Chinese province. So with a sister relationship, I am speaking of something like the German state of North Rhine-Westphalia having a province twinning with the Chinese province of Jiangsu. Having such a sister relationship more than doubles the amount of donations of medical equipment that your country will get from China. So the term mass diplomacy in itself already implies that beyond addressing humanitarian need, there might be other political motives at play. And this is, of course, something that you wouldn't want to have during a global health crisis. And in fact, if we look back, then we see that after China's initial cover-up of the coronavirus outbreak in the city of Wuhan, China was very quick to seize the opportunity to tell China's story well. And the country launched a massive media campaign presenting China as the savior of the whole world during the pandemic. And some countries were willing to offer China the praise and prestige that it wanted. So for instance, the president of Serbia was reported to have kissed the PRC flag upon the arrival of a team of Chinese doctors, which in itself is not a bad thing. But the worry here, the worry that is embodied by the term mass diplomacy, is that the countries that receive most medical equipment from China are not necessarily the ones that are most in need, but rather the ones that are expected to yield the biggest propaganda win for the Chinese leadership. So our very own paper investigating the export of medical equipment from China is currently in working paper stage. That means that there are several extensions that we would like to make ourselves. For instance, we would like to extend the time period to see if there are any persistent structural changes in the international trade of medical equipment. Then another thing that we would like to add are additional political variables. So for instance, we would be interested in whether the number of state visits to China matters as a form of economic diplomacy. And we would also like to investigate the role that Chinese diaspora in third countries have played, because we expect that these informal channels might have been very important as well. Then more generally, I think that economists should accept the big challenge of trying to quantify the extent to which international trade relations with China are influenced by political motives. Right now, I have the feeling that a lot of policymaking is informed purely by anecdotal evidence. And if we look at the US prohibiting TikTok, even the lack thereof. Of course, it's not very easy for economists to do so, because those questions that might be most relevant to policymaking are not necessarily the ones that lend themselves well to econometric analysis. But I think if we don't even try to put numbers to back up our arguments, then we're doomed, because there are important decisions to make, such as should the West decouple completely from the Chinese economy. And if we don't have numbers to back our arguments up, then those questions will be made on the grounds of ideology. And many of the benefits that international trade has brought us will be at risk.